You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello, and welcome to another episode of All the Pieces. I'm your host, Dr. Mohan, your Chief Quality Officer and Hospitalist. June is Men's Health Month. It's a month to reflect and do action planning for men about their health. There's some sobering statistics I would like to share with you. Men are 41% more likely to die than women from 8 out of 10 leading causes, including diabetes, heart disease, cancer, and such. It's also a great month to reflect on all the changes that are happening in men's health. I would like to share some other statistic with you, which is 31% of men suffer from depression. 1 out of 4 will not likely see a doctor about it, and 1 out of 3 will be on medication of some sort. These issues are not only prevalent across the board, but also men specifically. Of the percentage of men that do see a doctor, 60% of them only go for yearly visits, and 40% of them actually go when something is truly serious. But statistics are one thing. I would like to hear from someone in the community who practices medicine. And with that, I have a great guest with me, Travis Null. Travis, before we get into the statistics and how healthcare is for men in general, want to give a brief introduction for yourself?
Yes, thank you. Thank you for having me.
Absolutely.
So my name is Travis Null, and I practice a family nurse practitioner up in Albany and bounce back and forth between Albany and Stanberry. So I get to take care of quite a few patients up there, which is a blessing. And as far as starting, I started back in 2015 was when I started with Mosaic. Was a nurse on the floor before that point and started that at 2012. So it's been almost 9 years, and it's been a lot of fun.
Excellent. I've been here since 2015, and well, I can tell you things have changed dramatically here for the better. So you practice, like you said, family medicine in the community of Stanberry and Albany. It's always good to see our system reflected in these podcasts. What has your experience been like with men's health in general?
Pretty similar as far as the statistics go, as far as I feel like a lot of my patients, especially the elderly farmer patient, they a lot of times are going to come in when they really need you. Prior to that point, if they don't feel like they need anything, they feel pretty good about not being there. They're not super excited to come. So I think from a practice standpoint, when I do have them there, trying to make sure to think about their health as a whole and not necessarily for what it is that may bring them in. If it's a laceration, that's great. Let's take care of that laceration. But then maybe let's kind of talk about some things that they haven't gotten to hear because they haven't been there.
Right. I've noticed that too. I practice medicine on the inpatient side, and it's usually when it's too late, right? Preventative stuff has been sort of put to the wayside, and it's sort of a disease reflection out of excess or neglect or a combination of both, or when their wife tells them to come into the hospital, right?
Yep.
I can tell you from my own personal experience that it's usually my wife nagging at me to say, hey, get your blood work done. And as much as the statistics I am inundated with, I can tell you inherently I don't feel comfortable going to the doctor if I don't see anything broken or wrong. How do you change that perspective in your practice when, say, a farmer comes in for a laceration and then you start talking about their family history? How does that play out for you?
I think if we start to talk about the family history side of things, it just kind of opens them up, and they start to think of dad, grandpa, and kind of things that they went through. And when you get to see how that has affected them, then that changes their perspective on it. And so all of a sudden it becomes, if I don't have to go through that, how can we not? Right. And that opens that conversation as opposed to prior to thinking about dad and grandpa, great grandpa and so forth.
Right.
We're invincible. That's right. That Y chromosome, it has a tendency to affect us that way. So
it's something in that chromosome that just makes us neglect proper basic medicine, right?
Yeah.
And that's a good point you mentioned, that a lot of people start reflecting on their family history, and that's why they start thinking about changes they need to make. Usually when I'm being a little, reductive here, but people say, oh, my grandpa lived to 99, smoked 3 packs a day of cigarettes, never had a cough. How do you deal with those kind of tough patients sometimes?
Those can be really challenging, very challenging patients from that standpoint. But I think the take home from there is really just spend the time with the patients to educate them and, let them know about the risks that they are placing themselves under,
right,
and then how to manage some of those risks and give them, just the information. And once they have that information, even though their genetics may be super strong, things can change over time. And
Absolutely.
so just giving them that education and continuing to talk with them at visits that they come in later on about it too. So not just a one-time conversation.
Yeah, and I think that's a whole point of having a month dedicated to men's health is awareness. A lot of men that I encounter, and myself included, I think change begins with awareness first, that, hey, I have a problem or I have a family history of a problem. Maybe I should stop doing the things I'm doing or do something more of some things I've been neglecting. For example, both my parents are diabetic, and I know I'm at increased risk. So every time I pick up a donut, I'm like, okay, I do some risk, benefit ratio in my mind to say, not that nerdy, but at the same time, I'm like, okay, well, this might affect me down the road at some point. So that's a very good point that you made, that awareness is the beginning of change. These statistics that I mentioned, men are more likely to die from the 8 out of 10 big killers like cancer, diabetes, etc. Are you seeing that in your practice as well?
Yeah, I think so. And we see, especially I feel like heart disease really affects us quite a bit. I see a lot of heart disease in my men patients, or patients that are male.
Right.
And that has definitely affected them. But going back to that prevention part of that is the biggest part. If we can educate, as far as dietary changes they can make and exercise and trying to fight this epidemic that we have of obesity,
right.
Trying to make those modifiable changes is so important.
Right. That's another thing. It's all sort of related in a way, right? In medicine, we sometimes have a tendency to just fix the kidneys or just fix the heart, but it's all sort of connected because you are a whole person, and that holistic approach is always the better option. But that depends on if the doctor is good or the APRN is really good at building those relationships, and more likely that the patient's about to come to the doctor's office too, and not just being dragged there by their spouse or somebody else. We talked about depression a little bit briefly earlier. 31% of men suffer depression in their lifetime, and 9% of them have daily feelings of depression or anxiety. Is that something you're seeing in your practice, or do you ask those questions in your practice?
We do. We screen for depression at our visits, and which is really helpful because sometimes just asking the question gives them permission to talk about it.
Right.
And they may not be wanting to necessarily bring it up, but if you can ask the question, right, they may be more apt to let you know what's going on that way.
Yeah, you can be a little bit agnostic, but I'm just doing a quick check if you're okay, and that sometimes can lead to a future discussion. How good are you, or at least are you seeing our male patients leaning into depression treatments in your practice?
It's because over the last 9 years, I've seen that it's changing. I do see that over the last 9 years, it has felt initially like they're very resistant to any type of treatment.
Right.
However, I do feel like that culture is starting to shift some, and I am starting to see where they realize they don't have to feel that way.
Right.
And once they realize that they don't have to feel that way, and it kind of starts a little bit of a snowball, because if you treat one person, right, next night it's men's night at the golf course, and dude, you're looking like you're feeling well. What's going on, and then all of a sudden that creates a cultural change too.
Yeah, and I think that's the taboo nature of mental health in general, and I think men are much more resistant to it. I'm speaking anecdotally, of course, that it's considered a sign of weakness or a sign of a crutch even, but that's not the case. Mental health now, I think, is much more of a focus for healthcare at large, because a lot of people don't treat it or understood it well enough to say, hey, this is a treatable thing. And it's not weakness. It's something that you can ask your doctor about, ask your nurse practitioner about, and say, hey, how can I help myself feeling less helpless? And I think that's the big shift I'm also noticing amongst my colleagues as well as my patients is, I'm going to prioritize my mental health. And the role of the provider is to help them do that.
Yeah, absolutely.
Excellent. So, shifting gears a little bit, how do you feel our male patients feel about screenings in general? I know this is Men's Health Month in a way, but colonoscopies are sort of baked into that screening, but so is other types of cancers. How's your perception been in practice with discussing screenings in general with patients?
A lot of times there's no family history, and then that conversation tends to go to, why go looking for a problem that I don't have a problem with?
Right.
And so again, kind of going back on the educational piece of that, hey, from a colorectal cancer screening standpoint, if we can identify that there's a problem before you have signs that there's a problem,
right?
We can treat this, and we can fight this.
And I believe the colonoscopy age requirement has changed from 50 to 45 now. So you're having these conversations way early in the treatment or their care. So I'm about to turn 40, next year, and 5 years after that, I'm really, there's a big clock, that says I got to get screened. And I personally have, some resistance to it, even though I'm a physician, I know the statistics, I know everything. How do you deal with those type of conversations?
I think there's easier ways than necessarily the colonoscopy, and we talk about the colonoscopy, but, look at like Cologuard and how that's changing things. And now for, you're a farmer and you got to be taking care of your livestock. You can't commit that day, right. To go in and get your colonoscopy. Well, we can make that easier for you, and there's other ways to detect that there's a problem going on. So
excellent. What about the more sort of lesser known cancers, right? Such as prostate or testicular cancer. I remember when Lance Armstrong got testicular cancer back in the early 2000s, there was a big resurgence of awareness. Do you feel like that's still there, or do you think that people are just not aware of it, or what do you do with that type of?
The testicular and the prostate cancers are interesting to me, and especially because when we look at those things, it's predominantly based off of risk factors.
Okay.
There's a lot of it that's driven by that. And testicular cancer, even if it's not screened for, caught later on, you're having symptoms, the survival rate is really good. Right. And so current guidelines, unless there's high risk, they suggest not screening for testicular cancer, which is interesting.
Right.
And I think sometimes that can provide you with credibility to your patients too. When you talk about those things and say, hey, I understand that, let's talk about some of these screening things that we can do for your health. And these are things that we actually don't necessarily recommend doing. And because the anxiety that sometimes that they can cause if you're not having, any type of symptoms, you don't have a mass, you don't have a family history of testicular cancer or a personal history of testicular cancer. If you get any type of a mass or pain or sensation in the scrotal testicular region, I would definitely like to see you back and we can take a look and see what's going on. But I think having those conversations to where they don't feel like you're trying to always make them do something, because sometimes there is a little bit of distrust there.
Right.
And so that helps. And then, prostate cancer, it's more of a shared decision making. It's kind of moved towards that shift of things. And, it used to be everybody got a PSA test. Once they were at the right age, everybody got that PSA test.
And a lot of false positives with those.
A lot of false positives. And we know that testicular cancer, typically is a little bit slower to move or spread. And you most of the time will have symptoms of testicular cancer. Or sorry, I switched gears on you.
Yeah.
But prostate cancer is typically slow to move or spread. And most of the time you'll have those symptoms of prostate cancer before it would have moved or spread. There is some genetic variances on that, and sometimes you can see some different types. But I think having that conversation of the treatment of prostate cancer, maybe it's removing the prostate or maybe it's radiation or whatever it be,
right.
Those are going to have adverse effects with them too.
Right.
And so I think having that conversation of just risk benefits and going from there really makes a lot of sense with the prostate cancer.
And that discussion completely hinges on trust. If the patient feels that the provider is always asking me to do some sort of screening, even though there's no real backing by the United States, Prevention Task Force or any of the major guidelines, they might feel like you're just being another, trying to squeeze as much out of them. And that's very important when you talk about things that are not overtly known or detected in the patient, right? They feel like the doctor has the best interest of fiduciary duty to make sure what's best for the whole care. Excellent. Any other trends you've noticed that men should be aware about? I know a lot of things that you discuss comes up in a casual way from discussion and building that trust. Anything else that you've noticed in your practice that as a community we should be aware about?
I think I actually have a lot of guys that come in asking about testosterone too. That becomes, one of those kind of hot topic conversations.
Right.
They've been listening to the Joe Rogan podcast or whatever it be.
Right.
And
I would call them the new age outlive your normal amount of years type of health gurus, right?
Yes.
So I believe TRT, or testosterone replacement therapy, is a nice sort of pivot of branding, like cauliflower rice.
Yeah.
But it's the same thing as it was from back in the. It's are they steroids? Are they not steroids? Where are they?
Yeah, and I think I have, from as far as Albany Stanberry goes, it seems like there's more of that conversation comes in as far as like, hey, do we need to be checking my testosterone?
Right.
And I've been tired here lately, and should we be looking at my testosterone? Those kinds of things.
Right. And tiredness is such a vague symptom. It could be depression, it could be poor sleep, it could be stress causing adrenal fatigue. Any of those things that people are not really thinking about because it has a constellation of symptoms, but they're jumping to that, hey, do I just need a testosterone shot so I can look buff or feel more energized? Yep. But it could be a B12 deficiency.
Yeah, exactly.
It could be something along those lines. So, yeah, that's a very good point, because that's something I've noticed too. A lot of men in their 40s, right? They're seemingly healthy, father of children. They just feel like they're just run down, right? The stressors of life. And they are asking for testosterone replacement therapy, with their testosterone being in the normal range, which is like, I don't even know what it is, 300, 1200, like 1200 being your Arnold Schwarzenegger back at the scene, you're pumping iron, but like 400 to 600 being the normal age appropriate. So have you seen patients go on testosterone?
I typically would recommend against it if they don't have the need based off of their lab levels and symptoms too. And then there's also other questions of, what's causing the low testosterone if they do have it shown in their labs. And we can't just necessarily jump to, and maybe it's hypogonadism, or right. Maybe it's something going on with the pituitary gland. Right. So like we can't just jump there.
Right.
But it, at least that to me has also opened up that conversation though of again, what else can make us feel this way? And so I think a lot of times men have come in and they want to talk about testosterone, which is great. Let's have that conversation. But they lead that with the symptoms they're having. And so then it's like, well, let's talk about other things that may cause these symptoms too.
Right.
And that sometimes opens up those conversations about depression and some of those things that maybe wasn't what they had in mind to talk about, but it allows that door to kind of be cracked a little bit so that we can maybe start having a little bit of that conversation. So.
Excellent. I think that's extremely the right approach, Are male patients coming to you about weight loss drugs such as the GLP-1 agonists like Wegovy or Ozempic?
Not as much as my female patients.
I can imagine so.
Yep. The female patients are coming in for that. I feel like a lot more than my male patients. I do have some
Right.
that do come in for that too. And I think, again, when they come in for those things, talking about certain things, like sleep apnea and things like that.
Right.
And, just because that places them at risk, their obesity places them at risk for, sleep apnea. So again, talking about some of those things, and then, how can we affect the way that they feel, their quality of life,
Right.
By treating some of those things.
I completely agree. And I think the future is going to be a lot of those discussions. I think there's a lot of awareness around, I would call lifestyle enhancing medications that are shot a week, or, with testosterone, but they don't know the downstream effects just yet, because going back to the TRT, that may make you have lower body mass, possibly increase lean muscle mass if you need the medication, or a hormone in this case. But it can also increase heart disease. It can also increase your chance of stroke. So if you have all those risk factors, you really got to make sure the juice is worth the squeeze.
Yeah, absolutely. Or, is it their uncontrolled obstructive sleep apnea that's causing a little bit of their decreased production of testosterone, which both will cause their hemoglobin hematocrits to both go up, which
Right.
therefore also will the testosterone, which increases the risk of heart disease and stroke. So
Yeah, all good points. And it just goes to show that even though there's so much more products for life-enhancing medications, I would call them supplemental medications and hormone therapies, it may not be the best fit for you, right?
Yep.
Any parting words of wisdom for our male listeners out there in case they want to come and seek some help, or they don't know how to crack that conversation?
Yeah, I think, kind of going backwards a little bit, we talked about how there was kind of that stigma of, it's weak to ask for help or come in for help, whether it be depression or whatever they're dealing with. But that's actually strength. Strength is asking for help. And so when you come in and you talk about those symptoms, that allows us to get you help and get you feeling well. And that's huge to enjoy the years that we're blessed with.
Absolutely. Absolutely. And wiser words were not spoken. So, Travis, I want to thank you for your time today. Just to recap for our listeners, June is a Men's Health Awareness Month, but healthcare is taking charge of your life and what it means to you. If that means having a discussion and breaking taboos that you might have held long time, do that, because there's no weakness. It is a protected conversation. Travis won't go out there and post about it on Facebook or any of that side. Just know that there's help available. And if you're exhibiting signs of depression or feel like you have depression, please seek care. Mental health is also physical health. Your body is just not your mind. Your body is just not your heart. Your body is just not your kidneys. Connect with the doctor. Make sure you have a trusting relationship with them and go from there. So with that, I would like to conclude that men's health is as equivalent and important as women's health, but it's also about taking charge. So if you have any questions, please reach out to your primary care doctor, or if you're looking for a primary care doctor, Travis is taking new patients, I believe.
Yep.
Excellent. So with that, I would like to thank all the listeners. Take care and brush your hair.